Hello? Okay, all right. Okay, I guess cookie break is over, or you can still keep wandering back if you want. My name is Becky Pagotelis. I've been a physical therapist for over 25 years now, which is hard to believe. And the majority of those right here in Spokane. For the past 15 years, I have been really blessed to work with probably at least a third of my clientele is breast cancer recovery clients. And it's been a huge blessing. And for one thing, my grandmother had breast cancer, so I've always had a personal interest in that, even when I was back in school. And so that puts me in a high-risk category. And so I end up having to go back for follow-up scans a lot. I've even had to go back for a biopsy. And so I just count myself really fortunate that I already feel like I have this really strong community of support, already just even from all the beautiful and lovely ladies that I have walked through this experience with, and I can just see their faces and their strength, and it's just been a huge personal blessing. Other backgrounds I have is the certification in manual therapy and Pilates, and so I really enjoy taking those postural principles and like manual release techniques into cancer care. So my talk today is going to center on reducing lymphedema risk, so I'll tell you a little bit about that, scar tissue reduction, and then, following in line with Timmy's talk, getting you back to the things that bring you joy. That is super important to me. Like, you have to have a goal. I mean, is it kayaking? Is it rock climbing? Is it just being able to paint for longer durations? Like, whatever those things are, there's ways to break them down into steps and get you back to them. And for me personally, if I can't do the things that bring me joy for weeks on end, it's so much harder to cope. So very important. So medical interventions for breast cancer may include surgery with or without removal of lymph nodes, chemotherapy, radiation, reconstruction surgery, sometimes more than one, or a combination of these in any order. So, and sometimes radiation will be eliminated. And physical therapy treatment is actually helpful during most of these phases, but can be intermittent. And sometimes we'll take a break during radiation after skin gets tender, usually after a couple of weeks, and then usually don't resume for at least 2 weeks, 3 weeks after radiation. So today I want to just show you kind of some things to watch for and avoid, and things that can make treatment go a lot smoother through these phases if you just even know what to look for. And you don't always, it's helpful ideally, I think, to see a PT in the very beginning so you can get some measurements of like arm circumference and things in case you develop swelling in your arms. That doesn't always happen. That would be definitely my ideal, but even, because then you can, even if you're there just one visit, then you have a contact person. If you have questions, you can send an email, is this normal? And that can just be really helpful walking through the journey. And then sometimes I see people who never got referred to physical therapy, and it's years later, and now they have another condition, like a rotator cuff tear or something that probably could have been prevented if we would have got the shoulder in correct alignment and stuff. So that is kind of the main reason I want to get this information out there, is because it makes me really sad when I see things later that people are like, oh, I wish someone would have told me that. Okay, so lymphedema is a condition that can cause swelling in arms, legs, sometimes even the face and neck if things are affected through radiation. Mainly it's caused if there is anything that damages the lymphatic system. Scar tissue can do that, radiation, infection, multiple things that interfere with the whole lymphatic system. And it can cause pain, discomfort, reduced mobility. And a side note is also, even if it's not that uncomfortable, with some people it's relatively painless, it still increases the risk of infection, of cellulitis in that area. So learning how to do manual lymphatic drainage and clear the fluid out is really important. Here's a picture of the lymphatic system. So you can see there's nodes really concentrated in certain areas of the body, like the armpits, groin, through the abdomen, the side of the face, and above the clavicle here. So the main purpose of the lymphatic system is a network of organs, vessels, and tissue that work together to filter waste and move a colorless, watery fluid, which is the lymph, back into your bloodstream. And it really is a vital part of your immune system. So there are already existing drainage pathways that your body has to take things back to those zones where you saw a lot of lymph nodes for filtering, and then there's deeper systems that help filtrate right back into the circulatory system. But those areas can be, like I was saying, interrupted by scar tissue or damaged lymph nodes, usually radiation or surgical removal. So if you have lymphedema coming on, one of the best things is to be able to detect that early. And it sometimes feels like a cold sore coming on. You can feel that little bit of tingling or heaviness of a limb. Sometimes if there's either edema in the side of the chest or the top of the arm, it'll just feel like your arm is sticking out a little further and doesn't contact your body the same way. And sometimes visual changes on the arms or hands. So one of the earliest places you can detect it is just looking, like if your hands are starting to get some edema, because that's kind of the end of the chain where everything is pulling back up. If you look at your hands and make a fist, you'll see hills and valleys here with your knuckles. And so a hand that is getting more swollen will just be getting flat across. So you can also look at your vessels on the top of your hand, and if you can see easier on one side than the other, that's a good way to tell. Also, if you bend your arms like this area here of your forearm will you'll be able to feel density here, that it will just feel a lot thicker than the other arm. Much the same way as if you sprain your ankle, that fluid will tend to gather under that bone there. So those can be helpful things. And if you do note those things, don't wait. Go see your doctor and bring it up. Sometimes medical professionals will just say, let's watch that and we'll see what's going on with that at your next visit. Don't take that for an answer. The majority of the time, if you really are feeling the tingling and stuff, try to get some help soon, because that can make the difference of a long course of physical therapy or sometimes just getting in a compression sleeve and being able to manage it on your own, and it goes down. So definitely worth looking into. So new pathways can be developed to other areas. When we looked at that screen before with the lymph nodes, say, for example, you have a lot of lymph nodes taken out through the armpit, and so that is kind of the main area of drainage for the arm, and there's scar tissue, healing happening there. We can tap into another area, like above the clavicle here, by the side of the neck, has a lot of lymph nodes. So over 3 to 6 months of doing a gentle skin glides to that area, roughly every 12 hours, you can create a new path. And the way that works is the early lymphatics are just connected by a filament to the skin, and they're just one cell layer thick. So as we do just a light massage, just enough to move a mole, or how hard you could like pet your cat before, kind of arch, and then it'll take off if you're too rough. And it just needs to be gentle, because otherwise we just kind of smash those one cell layer thick cells shut. But you can kind of move it along this chain and develop a new pathway. So pretty cool. Similar, like the body can develop a new nerve that has been damaged, a new pathway for those things. So that's also the area that we're going to take the fluid to. We would prepare that with think of like a sponge under that area where all those nodes are, and we do like a deep pressure release, just like you would kind of push pressure on a sponge and get the water out of it and put it back in. So prepare the area with at least 10 of those of a moderate pressure, and then you do at least 10 of the glides to that area. That being said, this is complicated, so you probably should get the help of a therapist just to make sure that things are going to the right routes and getting set up with this. And then it's something you do on your own, so it doesn't have to be a lot of therapy by any means. And the other thing with that is that, hold on just one second, I think it's on the next slide here. Okay, so exercise is another way, when I talked about those pathways moving along, to naturally feed into that system of the early lymphatics draining. That's why most of us just are reaching to the cupboard. Everything we're doing through the day uses the early lymphatics enough that you get that drainage into the deeper systems. So you can, just by turning your head far enough side to side, arm swing, walking, overhead reach, we talked about stress balls, and then diaphragmatic breathing is really important because that really stimulates that whole deep central area that we looked at, and then between, on the sternum, between all the ribs, there's a lot of lymph nodes right in here. So with your breathing from time to time, you can just kind of benefit your whole system by thinking of taking a big breath like an umbrella opening. So not just in the front, but even around into the back, that you're doing like a 360-degree breath. And that will help stimulate all of that. So scar tissue is something I feel really passionate about because this is one of the big things I'll see like several years after a surgery. And there's still a lot you can do, even if it's an old scar. But skin needs to be able to glide in all planes. So if you ever have any kind of a surgery, if you notice that you move your skin and it gets hung up, or you can see like a dimpling there, you want, just like, you know, on your hand, you could slide across, up, down, diagonals. All those planes are important because the lymph will not flow across scar tissue. So I see this time and time again. If somebody has lymphedema in their arm and they have a big scar here, we'll see it like right up against the edge of that, and it's just rounded there. It won't go through it. So you need to use techniques to glide that around and do lymphatic drainage around the scar. Working with scar tissue also helps restore nerve regeneration and get normal sensation back there, again, after surgery. And scar tissue release also will soften areas of that firm edema to help with the drainage. So also with the drainage, I was talking about the areas where you do the lymph node pump and then you glide. If there's an area that's really hard and firm, you want to soften that beforehand to try to drain that up. And I think I talk about that in this one. Okay, yeah, I'll go back to here and tell you about it. Okay, so the layers of skin, you can kind of think of them as almost like lasagna noodles in an extent. And in between these layers, there's vessels coming through and lymphatic vessels to drain, nerves, veins, arteries, all of that. So when you, sometimes with radiation, those tissues all kind of are gnarled up together, especially on the chest, is one area that I can really see things adhere down. So the technique that you use to get those flowing better between them is like you just kind of land on the skin. It's not a massage where you're moving, but you glide in a direction and then twist a little bit, and that helps kind of release those. So that's a helpful technique for any scarred up area too of the body. And that glide and twist is what I will use with just fingertips if there's an area of firm edema, like if you were really firm here first and you kind of loosen that up. Glide as far as you can without, where you can't really slide anymore and you're still on the original skin, and then you twist, and that can help soften areas of edema. Okay, so axillary cording can develop from an area where there is a scar. So if you have a scar in the armpit, sometimes you'll notice strands that look almost like guitar strings, or another thing like fishing line almost. And you can see them kind of through here and then through the front of the arm, sometimes obvious here. And the things are pretty severe. You can sometimes even pick them up down at the wrist. So those are just lymphatic vessels that have become inflamed. And the important thing about those is that sometimes people will just try to stretch to relieve that. And the lymphatic vessels are similar to like a nerve tightness, where you want to do just like a slow, kind of like a rocking chair speed on-off pressure. They don't like sustained stretch, and it really inflames things even worse. So try sticking your arm out for me and just pulling your fingertips kind of back towards your face with your elbow very straight. You'll feel it mostly if it's to the side, but I mean, you probably if you don't want to hurt your neighbor, I could do it in front too. Anyway, do any of you feel a tightness like up into your middle? That's your median nerve that we're stretching. So if you do feel that, that's so that to stretch those kind of things, or the chords, we do kind of like an on-off, like you would come up, feel the stretch, and then release it. Come up a little bit higher, feel the stretch, release it. So it's not like a whole 30-second kind of stretch. And that's why it's important to get someone involved in that. And some of the only like severe injuries I have seen to someone's lymphatic system during rehab or with something like this is like side plank is usually something I tell people to kind of never do again on full stretch like that. You could be on your elbow or something, but when you can feel, if you felt the tightness there, like if you were on your side and you wobbled, you could potentially tear something. And then someone else was trying to move like a couch up a really crowded stairwell and twisting in a difficult position. So you just want to kind of avoid lifting on when your tissue's on full stretch or doing anything extreme on that. Okay. Other treatment interventions for lymphedema could include compression wrapping for reduction. So if the arm is really swollen, we use layers, kind of looks like ACE wrap, but there's a couple under layers too to help smooth out the bumps, and then a specific like figure 8 kind of wrapping pattern, basket weave, actually it's called, up the arm to help redirect the fluid kind of in channels up. And it's very effective at reducing. Usually we don't do that unless it's at least a couple centimeters bigger than the other arm. And then compression sleeves for maintaining that once you get it down to the size that you want. The compression sleeves are very good with that. And sometimes that's all people need is just one of those. There's specific night garments that are more comfortable than doing all that wrapping. Kinesiotaping is a really great adjunct in this. I don't know if anyone is familiar with that. You'll see it in the Olympics and everything. A lot of athletes wear it for various purposes to help enhance or support muscle activity. But you can also use it for draining fluid back to an area, or if you have even bruising, it's pretty cool. You can put it on and even make like a lattice print and take it off a day or two later, and you'll see that it removed all of the bruising in the area where it was. So for just light edema in a certain area, or sometimes if it's in the breast, a place that you can't really wrap, you can use that tape. It has a stretch one direction on it. So you anchor it and then you pull it where it's got a little bit of stretch, and it'll keep pulling the fluid back to the anchor point. So that's very helpful. And there are lymphatic pump options for chronic edema too that can be assisted with, but they're more of a chronic thing because they're pretty expensive, and insurance companies, it can be difficult to get. But okay, so prevention, the compression sleeves we talked about. I like anyone who has multiple lymph nodes taken out to have already just like a prophylactic sleeve on hand for air travel, because the pressure gradients will sometimes cause edema. Also, bee stings, like if you tend to be allergic to bees or anything else, and sometimes that stuff happens on the weekend and it's hard to get to the emergency room or anything, it's just handy to have something on hand. Also, noting that sometimes the amount of lymph nodes taken out doesn't always correlate to someone who will develop lymphedema, honestly, because I think it's the scar tissue in the area and how much scar tissue that your body may form. So even if you get 2 or 3 out, it's still a possibility to keep in mind, and I would still recommend getting a sleeve. So manual lymphatic drainage, prevent infection at all costs, like wear gloves gardening. If you get cuts or scratches, try to do Neosporin or whatever you do to put on those things to prevent infection. Like cat scratches can be a big thing. Like sometimes years down the road, a cat scratch can cause trouble if it's not taken care of. And then avoiding blood draws in involved arm, any aggravating activities such as excessive lifting, high heat in hot tubs, Although you can kind of, once you're managing this, you can kind of figure out, okay, I can put my arm on the side, or I can be in for 5 minutes and I'm okay. You have to kind of weigh out some of these things, or a certain temperature that's aggravating for you. It's not an absolute no. And return to activity gradually. So there have been people who are active tennis players, crew, who will, usually it's recommended to kind of wear the sleeve during an activity that could be aggravating, but if you wear it even for 2 hours after the activity, if it's something in the water, people have been able to get back to doing just about absolutely everything that I don't know of anyone who hasn't been able to get back to an activity with the right use of a sleeve to modulate. Okay, here are a few principles for returning to exercise. Restoring posture and mobility first is a really important thing. And I think in the beginning I mentioned like someone might come in with a rotator cuff issue later. Well, if the pectoral muscles get really tight and shortened and you aren't stretching, then your whole shoulder is not where it used to be and kind of riding on the front of the capsule, and the rotator cuff muscles get really stretched from the back. And so it's very easy to develop a secondary shoulder problem because there's just not that much extra space and room for inflammation in the shoulder. And so if you're doing something out of alignment and it's painful with each repetition, don't just keep going. Like, you have to figure out what the cause is for that. Avoiding shrugging during reaching and lifting. So most of the time, our automatic response when you've been in a sling or after surgery is to kind of protect and hold up. And learning again to kind of reach with keeping this part down, like a teeter-totter. This is down while your arm is coming up, can just keep a whole host of things like the rotator cuff from issues from occurring. And incidentally, like squeezing, I mentioned our squeezing shoulder blades gently together while you're doing those reaching activities. You can feel how that kind of engages your muscles a little bit differently and helps with support. Also strengthening below shoulder height first. So kind of in this box here, get this strong first before you're starting to try to lift heavy things to overhead cupboards. I brought just a little band here to show you. So once all swelling is gone, everything's healed, and we're ready to get back to work, I usually have people start working the rotator cuff just with some small band things here. You can do diagonals, practice reach with keeping that band together, and lifting with keeping the shoulder down. It just kind of forces the muscles back there to do what they're supposed to. So it's kind of, with your shoulder, it's like you have a core too, and that's your rotator cuff. Just like with lifting, you would engage this core first. So the whole series of exercises with the little bands that are easy to do. And then gradually progressing weights and repetitions. Generally, I'll tell people to do like tired plus 2. So don't just add 10 reps just because 10 went good last time. Each time, try to gain a little bit on what you were doing, but it's minimal. Fatigue plus trying a little bit more. And then this is a really important thing. If you've had radiation, stretching daily for up to 2 years, or pretty close to that amount of time, because it's just kind of a very slow process where things can tighten back up if you leave it alone or just think that you're good enough. So even if you end up taking a week off on vacation, or just get back to trying. Overhead pulleys are a great way to do that, or wall slides even. There's lots of good ways to stretch even with stuff that you have at home, I'm sure. So physical therapy can help with, hit on most of these: mobility, posture and joint alignment, strength, help you function with decreased pain, return to all the chores, gardening, and then my favorite part is return to sports like golfing, tennis, skiing, kayaking safely, and prevent secondary injuries like rotator cuff tears, tennis elbow. And we talked about no pain, no gain. I think the shoulder is one of the primary areas I see that. There's just, honestly, if you look at the anatomy of it, you've got the hood of bone coming out here, and underneath there's bursa and little tendons coming out to attach onto your arm bone underneath, and there's just minimal space. If you get a bursitis or any inflammation in there, it doesn't take long till you're shrugging and doing things incorrectly, and you nip it in the bud, you can usually get right back to the things that you want to do. Okay, so knowledge is key. Don't settle for becoming less active. Honestly, if whatever you love to do can be broken down into steps, and I usually see really positive outcomes from people that are doing what their doctors have recommended and then also engaging with physical therapy. So keep a positive outlook, and this is my contact information if anyone wants to shoot me an email with questions. Not all PTs are right off the bat going to be trained in scar tissue release or lymphedema. So those are kind of two key phrases I would say if you want to write down in the future, to just ask those things when you're calling and scheduling with anyone to make sure that they're trained in those, because those were not a part of like basic PT education. These additional things. Anyone have any questions? Absolutely. Yeah, that's pretty common because this is a big, like the cisternochyli is the name of the area that's kind of taking up the fluid here, and it's right near the belly button level. So a lot of times this area will become swollen, and there's manual lymphatic drainage techniques for that too. And sometimes with if it's been like a surgery with a big scar across here, like a tram flap or something, there's not going to be lymphatic drainage down through that scar like we talked about. And so for the lymph nodes on the front of the groin, it's not going to be going there. So we have to feed into drainage more primary in the abdomen, or you can even go like across around the back to the spine that way. Yeah, absolutely. Any other questions?
Is there any way to help treat that numbness or the tingling and discomfort of a surgery?
Yeah, that's a good question. It can take up to 2 years for full nerve regeneration. So there's always going to be a stage of where that, if it's starting to tingle and stuff like that, that's great. I mean, it's kind of like if you have ever gotten your hand really cold or really hot, like there's these sensation gradients that kind of come back, and you'll feel, or even put ice on yourself, it'll kind of feel tingly for a while. There's these stages until you get to absolute numbness. So you're kind of reversing back from that. And then the manual lymphatic drainage that I talked about, all those skin glides, they do help with nerve regeneration. So you can, with the fingertips, you could definitely glide and twist in a numb area. That could help if there's little adhesions down to the nerve too, for sure.
So I've had a lot of that underneath of my arm. Could I use that same skin gliding technique to help with the numbness and tingling underneath of the arm?
Are you talking about edema as well, or just decreased sensation?
Decreased sensation, like with the nerve tingling. I don't have any numbness anymore, but often still sometimes I'll have nerve tingling.
Okay, yeah, that's part of that nerve regeneration phase. So I would just make sure to keep, touch the area, pull inward, try the twist and glides. That usually accelerates that a little bit with helping the nerves start to pick up sensation normally. Scars are a big area where it's been shown that doing the transverse massage across the scar helps with the regeneration across the gap. So if a scar feels weird or tender, don't give up. Keep working on them, and it will eventually feel a lot more normal like your other tissue. But yeah, 2 years it can take to get all that sensation back under the arm.
Okay.
or what you're going to get back in 2 years is what you will, I should clarify. So sometimes there are permanent losses, but if you're feeling the tingling, that's a good sign that's coming back.
Hey, I just was wondering if for a couple minutes, like if we heard from Annalie that exercise is good and people like me right now have not been exercising and just preparing for this, I'm like, man, I really need to make some changes in my life. It's embarrassing, but it's true. So like if you're capable of walking, and I know if it was anyone, who maybe has severe mobility issues, you'd probably need to see them. But if you're someone like me who's relatively capable of walking, like how would you start an exercise regime? Like, and how much stretching should there be? And how much cardio? Like, what would you do? I know you run, so it's not fair, but.
Well, some. I mean, generally starting, if you look at like those couch to 5K type of programs, I mean, if you're in rehabilitation, that may be a lot to even go out and walk 5 or 10 minutes to start with. So that can be a good place to start. And if that's easy with the walking, add 5 minutes a time. Stretching, I didn't go into too much detail on exercises, specific exercises, because, for instance, if you're the type of person who's getting that axillary cording and someone's telling you to, do the pulleys and stretch up the wall and push, you don't want to push into the stretch. You kind of just want to do a little bit, engage the barrier, and back off. So cardio, if you could do like an exercise bike or something like that in addition to walking, if you have access to that, and just start with like a 5-minute time on it, that would be great too, and increase. It would be good to get to the point where you can do 30 minutes of walking or an exercise bike or something of that nature. And then strengthening once things are resolved. Like I said, you don't want to aggravate things, make sure someone's helping you. There's kind of a pattern where you can work through exercises first that you have support for that arm. So it might be sitting at a table and just gliding your arm forward there, or putting your arm still if that kind of hurts, and scooting your chair back instead to stretch. So you get all that going first, maybe use pulleys so that your strong arm is helping the other one gently to the stretch, and you don't want to hold really long. Once that's easy, then I will oftentimes have people use like a wand or a broomstick. If it's hard to lift your arm on your own, you're probably going to be doing it with a lot of shrugging that you shouldn't. So use something to help you get up there. And then once you can take that off and hold it without dropping it all, you can try different ranges in that. So that can be a good way to build yourself back, is gradually going through that process of assisted exercise and then to regular. And then I showed the little series with these that will just develop like a strong core through your shoulder, and then getting back. Yeah.